Hello, class. First of all, I'd like to welcome you to Nursing 121. And we're going to start week 1, day 1, with the concept of healthcare delivery. And our exemplars for this concept are healthcare settings, which we're going to talk about with this PowerPoint. We're going to talk about the healthcare team members, and then we're going to look at the National Patient Safety Goals. Okay, and do some activities with all of these exemplars. I have here on the screen the PowerPoint that goes with healthcare delivery, and you'll notice that in Nursing 121, since we do have exemplars, Dr. Joris and I do provide you with some PowerPoints to kind of outline a lot of the important information from the chapters that you're assigned to read. So let's take a look at this PowerPoint. With healthcare delivery. The concept of healthcare systems is the way in which we are able to deliver that healthcare and manage that healthcare. And it now takes a combination of cost containment, a lot of important strategies that are used. Obviously, informatics is a big part of healthcare delivery. Most of our charting and documentation are through the electronic medical records. And then, of course, all the medical technology, which we'll talk about some of these variables that are so important within our healthcare system of today. Now, when we talk about healthcare services, we look at 3 different types of prevention, all right? And the first one is called primary prevention, and this focuses on health promotion and illness prevention. This is probably one of the most important preventions, because we want to provide the information to the community and the people in our community to prevent the illness from even happening, okay? And so it does focus more on health promotion, and this is really what's kind of changed in our healthcare delivery. Years ago, we saw patients only when they were sick. But now we really try to focus on health promotion, meaning we want people to come in for their yearly checkups. We want to continue to monitor people's lab work. We want to continue to monitor a person's lifestyle behaviors, because, again, we're focusing on preventing the illness and preventing the disease from occurring. And our primary goal with these people are to avoid the development of diseases as much as possible, and really to promote healthy living. All right, and I think we're doing a pretty good job of this. We do see some of the chronic health issues still occurring. For instance, cardiovascular disease, diabetes is definitely on the uprising. But I think we are seeing people have a better awareness of the way in which they can live a more healthier life to avoid some of these chronic problems. And I think one area that we've really done a good job in is the cessation of smoking, especially with our young teenagers and even adults as well. We've definitely shown how serious it is and how smoking does affect one's health in so many different ways, okay? Again, when we talk about primary prevention, as I said earlier, back in the 1980s, healthcare was actually illness and disease care. We really didn't teach people what to do to avoid getting sick. And individuals typically access the healthcare systems only when they were confronted with some type of illness or they got in some kind of accident, okay? And the 1979 Surgeon General's report from the federal government's Healthy People program did lay the foundation for a national prevention agenda, okay? And this is where Healthy People comes into play, where they look at all the diseases that are occurring in our country, in the United States, and they update that every 10 years to kind of see what do we really need to focus on, what are the problems that we're seeing with the health of certain populations across the lifespan. And this is where Healthy People looked and saw that childhood obesity and children's nutrition was definitely a problem. And we've kind of known that, where we saw many of our children nowadays somewhat unhealthier than they used to be, probably due to the fact where they don't get as much exercise, they don't play outside as much. So we have seen the weight of some of these kids really start to rise over the years, probably because they're playing a lot of video games, technology. Maybe we've taken out some of the physical education courses out of our schools. So that may be the reason we do see this increase in childhood obesity, and definitely a problem with a child's nutrition. And then we looked at physical activity across the lifespan, dental and oral health, tobacco use, smoking cessation, and really health screening recommendations. And we did talk about this back in Nursing 100, where we looked at some of those tables and saw what was the appropriate age to have certain types of health screenings done or assessments made, what labs should be done, maybe certain kinds of vaccinations, depending on the age group of that particular person, okay? And since 1979, Healthy People has set and monitored these national health objectives to meet the health needs of people in the community. And we've also tried to guide individuals toward making informed health decisions and measured how these have impacted these prevention activities. And again, Healthy People 2020 set a number of goals and identifies a number of leading health indicators discussed in some of the other modules that have resulted in an increase in the quality and length of life, and we've kind of eradicated a lot of some of the health disparities that we've seen with certain people. And now Healthy People 2020 has provided new initiatives that address health issues that come to the forefront of healthcare in the previous 10 years, and those are such as dementia, including Alzheimer's, healthcare-associated infections, a lot of the early and middle childhood health, and then we've also seen them look at the lesbian, gay, bisexual, and transgender health, which we somewhat discussed back in Nursing 121. And they've already started to look at collecting data for Healthy People 2030. And the Office of Disease Prevention and Health Promotion seeks public feedback on their efforts. So they do keep track of the type of illnesses that we see, more of a higher incidence in certain age groups with the people here in the country, in the United States. And we know that we as nurses have such an important role in promoting good health for the people in our community. Our goal is to be able to teach patients how to stay healthy, thus making that person well and avoiding some of the very serious types of chronic disease and even some of the acute infections that we see. And as we all know, we're going through a very difficult time right now as we're dealing with the coronavirus as well. And our ultimate goal is to ensure that patients do understand the importance of setting health goals for themselves and their children, and that patients are able to assess, implement, and evaluate the goals and modify them as their health needs change. And that's very important as well. Again, nurses do participate in health promotion, including providing health education at every opportunity, evaluating and screening patients to identify prevention, providing opportunities to teach parents about immunizations, and promoting wellness in the community by organizing and participating in community events such as health fairs. And we here at the college do that quite often. We do provide health fairs where people can come in and have their blood pressures checked, have their cholesterol checked, have their blood sugar checked, which could indicate that maybe they're possibly at risk for developing some of these chronic problems such as cardiovascular disease and even diabetes itself. So that's what we're kind of looking at when we're talking about primary prevention. And this one is so very important. And if we can definitely prevent the person from getting sick, the person will be so much better off, okay? Then we look at secondary prevention, which focuses on early disease detection, and we offer and educate about the treatments to prevent progression of that disease. And really, the key to secondary prevention is really early disease detection, okay? And in order to do that, early detection is provided through screening. And screening is that way in which we can see if someone has a certain problem such as hypertension, or maybe they have some sensory problems such as visionary or hearing problems. And a lot of times this is why it's so important that people see their healthcare providers at least once a year, maybe sometimes every 6 months. And you know, if they suspected that that person, maybe their cholesterol was starting to go a little bit higher, and maybe the patient was put on some medications, or we tried to change their diet, or encourage the patient to exercise, or else they could be screened through some of these health fairs that we were talking about earlier. And then the last one is tertiary prevention, which involves restoring function, decreasing disease-related complications of an already established disease. May also include rehabilitation and some palliative care. And our goal here is to focus on controlling some of the symptoms and really promoting the highest quality of life possible for this person. Say, for instance, if they do have cardiovascular disease, or they've had a heart attack in the past, or maybe they've been diagnosed with some type of cancer. This would be our role to provide them with the information necessary that they're living the best life they possibly can and have the best quality of life as possible. And please refer to your book on page 2777 in volume 2 of your Pearson Concepts book. It does have a table, 46.1, which talks about these levels of prevention, primary, secondary, and tertiary, and it gives examples. So these would be a great way to kind of really make sure that you understand these 3 types of healthcare services. For instance, with primary prevention, we would educate individuals, families, and populations on topics such as the importance of nutrition, exercise, dental hygiene, prenatal care, immunizations, and smoking cessation. So that would be an example of primary prevention. And with secondary prevention, now remember, the person already has the disease. Hopefully we've detected it early, and we want to prevent further progression. So we would encourage performing risk assessments for healthy people who have risk factors for specific diseases, such as coronary artery disease and diabetes, then work with each patient to develop and implement a risk reduction plan. Or teach patients to perform self-screening examinations, such as testicular examinations and mold checks for possible melanoma. So maybe you see from the history of a person that they've had a lot of exposure to sun, and maybe you've seen some kind of concerning moles on the patient's skin, you would definitely want to continue to assess that mole to make sure that it hasn't developed into site-type melanoma. And then with tertiary prevention, an example would be to refer a patient with a new urostomy to an RN ostomy and management specialist to learn how to care for and improve life with an ostomy. Or you might refer a patient with diabetes to a registered dietitian for education on how diet can affect the complications of diabetes. So those are just some examples in this table that kind of help you to understand these types of healthcare services. Then we look at this next PowerPoint slide on types of healthcare settings, where we can see primary care delivered in physicians' offices, hospital-based clinics, community health centers, and public health service organizations. And this all makes good sense, because think about what primary care is all about. It's that primary prevention, and we're able to do it in these particular healthcare settings. And primary care setting often is the entry or gatekeeper for managed care. And then we look at secondary care, which can also be delivered in hospitals, outpatient surgical centers, specialist offices, and then tertiary care can be delivered in hospitals, rehabilitation centers, and extended care facilities. And these are just some of the examples of how this particular health care is delivered to the patient. Okay. I want to talk a little bit about factors that definitely affect the delivery of health care, okay? So let's kind of go over these, all right? The first one is about changing demographics. As your book talked about, by mid-21st century, the United States will be more racially and ethnically more diverse, where we're going to have more older patients according to the U.S. Census Bureau. And you may have not noticed, but the 2020 census has been sent out, and I personally had one delivered to my household, in which I was able to fill out that. So they will be taking a closer look at the age of the populations that are existing in the United States of today. Minorities will be about 1/3 of populations, and in 2043 they're expected to be a majority. So that will definitely change as we talk about changing demographics. And in 2030, which is only 10 years from now, nearly 1/5 of U.S. residents is expected to be age 65 and older. So as I've said before, and I even talked about this somewhat in Nursing 100, we're going to see people living a lot longer, and we're going to see more older adults and more racially, ethnically diverse patients. From the years 2008 to 2050, adults ages 85 and older will triple. And again, this definitely confirms the statement I made about how we're living longer, and that we're going to see more of these geriatric patients living. The effects of aging, long-term illness, and lack of primary care will increase the need for management of health care and support systems as well. Let's talk about advances in technology. Constantly change is the new norm in medicine. We're seeing new ways all the time of the way we do things, the way we do procedures, the new medications that are coming out. All this changes. We will also see more scientific knowledge with more sophisticated technology. Information management has created and or continually being more refined. Charting, labs, use of online evidence-based guidelines will also be implemented in healthcare delivery. Examples of that would be safer anesthesia, laparoscopic surgeries. We have more surgical centers where we see people coming in the morning and having surgery and then leaving by the end of the day, where we don't have to see people stay overnight anymore. So this is where that's also taken us, okay? Economics have also changed. There is an uneven distribution of services, access to health due to insurances. Women's health has changed. We talk about some of the vulnerable populations, such as the homeless and the poor. Remember, advances in technology that require specialized personnel creates new job opportunities as well. Let's talk about health literacy. What does that term mean? Think about it from your reading. Health literacy is defined as the degree to which individuals can obtain, act on, and understand the basic health information and services needed to make appropriate healthcare decisions. Again, we're focusing more on patient-centered care. So as a patient, they need to have that information about their health, about the services that can possibly be rendered to them, and then they are able to then make that appropriate healthcare decision, okay? There was a study done where 19,000 adults, 16 years old and higher, in households and in prisons, and the results showed that they had a slight majority had an intermediate level of health literacy, meaning that we still saw people who really did not understand what was going on with their health issues. 36% had a basic knowledge of health literacy. Lower health literacy was seen in those 65 and older, which makes sense. A lot of our elderly patients may be due to sensory deprivations, maybe due to the fact that they have chronic diseases, maybe the reason why they so that could be a reason why 65 and older may have some issues with health literacy. Low socioeconomic status and lower educational levels for some people. White and Asian had increased average than African Americans, Hispanics, American Indians, Alaskan Natives, and multiracial and Hispanics had a decreased average knowledge of health literacy. Healthcare illiteracy and ineffective communication will place people at poor health outcomes, okay? So important to understand that. So that's what this screen is all about, or this particular PowerPoint slide as well, okay? So those are the factors that affect the delivery of health care. So make sure you understand those, read those over in your book, and then understand the reasons why, okay, just like I explained, all right? So let's look at frameworks for providing care, okay? The first one is managed care. It's much more cost effective. It provides high quality care and improves outcomes for groups of patients. The primary managed care models are health maintenance organizations, or you might know them as HMOs, or preferred provider organizations, also known as PPOs, all right? So let's kind of talk about the differences between HMOs, which are health maintenance organizations, and PPOs, which are preferred provider organizations. And I want you to really pay attention and listen to this, because students always seem to get this wrong on the test, and I want to make sure that you do understand when we talk about managed care. When you hear about someone having HMOs, all right, in which that's what provides their insurance for their health care. HMOs are more restrictive than PPOs and require that a patient select a primary care physician who manages the patient's even secondary and tertiary services, okay? Where your PPOs is less restrictive. And the person may have a wider choice of who they would like to see, maybe be their primary health care provider. Maybe they have to see a GI specialist. Maybe they're having all kinds of GI issues, and maybe there's 4 physicians to pick from, and they're able to have the ability to pick which one they want rather than being told who's on that list of HMOs, where PPOs is less restrictive. But the direct costs to the patients are higher. They have higher premiums and co-payments and deductibles. So you have the privilege of selecting who you want to be maybe your physician with some kind of, specialty area or even a primary care provider, but it's going to cost you, okay? Your premiums are higher, maybe your co-payments are higher, and your deductibles are higher. So that's something you might want to consider. But if you're concerned about who that doctor is and you don't want that doctor to be your doctor, then you might want to go with the PPOs, okay? So that's one framework, managed care. The managed care involves PPOs and HMOs, okay? So be sure you read through that. The second one is case management. This is a collaborative process of assessment, planning, facilitation, and advocacy for options and services to meet an individual and family's comprehensive health needs through communication and available resources to promote quality and cost-effective outcomes, okay? And when we talk about multidisciplinary terms, led by a case manager at the heart of that successful case management. We did discuss a little bit about this and the different healthcare team members, and one that we have talked about is a case manager. And you as an RN could someday be a case manager, where you are managing the care of an individual, especially when they're being discharged. So you might have to involve other people from different disciplines to provide the best care for that patient when he goes home. Essential when a patient has multi-care needs and requires the services of multiple providers. Patient might need a physical therapist, but then he might need a dietitian to help him plan his diabetic diet, but then he just had a total hip, so he might need a physical therapist to help him when he goes home to regain his mobility. All right. The goals are to reach and then maintain the individual's optimum level of health, quality of life, and activities of daily living. Okay. And of course, a case manager can be a nurse, a social worker, or another healthcare team member. Okay. Those are the individuals who can serve as a case manager. And again, we talk about continuity of care, regardless of the location at which that care is provided as well. All right. And then lastly, we talk about client-focused care, and that's a delivery model that organizes healthcare around the expressed physical and emotional needs of the patient. And this is where patients and families will make decisions about healthcare delivery. Okay. So those are the 3 types of frameworks for providing care: managed care, case management, and client-focused care. All right. And so please make sure you understand those 3 types and what each one does involve. Okay. So let's look at the different types of nursing care delivery systems. The first one is called functional nursing. It's more of a task-oriented It's much more cost effective. The unlicensed assistant personnel, or the UAP, really does play a very, very important role in functional nursing. And what this means is, say for instance, a particular unit had a few call-ins, they were short some RNs. What they would do is they would kind of not really assign patients to the individual healthcare workers, but they would assign tasks. Maybe they would give the one RN the responsibility of passing all the meds. Then maybe they would give another RN the responsibility of like making rounds with the doctors and taking off all the doctor's orders, okay? Maybe somebody else is responsible for maybe doing all the dressing changes on the floor. Things like that. It is an efficient approach because you can really complete a lot of tasks in a very short time. But the only problem with this is it becomes very depersonalized and very fragmented, which means that you really don't look at the patient as a whole because you're not providing all the needs of that patient. You may be doing one aspect of the patient's needs by giving them meds, but that's as far as you're looking. Maybe you're not doing the assessments on the patient, so you aren't really getting the full knowledge about the patient and looking at him holistically, okay? And a lot of registered nurses do not like this type of delivery system because they really do like to develop a relationship with their patients, and they aren't one to always think about doing task after task after task. They like the relationship that comes along with being a nurse with their patients as well. Team nursing is probably what's used most frequently today. That consists of usually an RN at the head of that particular team, where she has either an LPN or a UAP helping her with maybe 4 or 5, 6 or 7 or 8 patients, depending on the type of unit it is and the acuity of those patients. It's a delivery model most frequently used today, and it does provide individualized care to patients in which the team leader is accountable for the care provided to the patients assigned to that team. So even though the RN is not personally delivering the care to the patient, she's still responsible to be sure that that care is being delivered. And what I mean by that is she or he would be sure that that person has gotten the proper hygiene that day, or if there's an order to walk the patient 3 times a day, that the patient is getting up and walking, or if the patient should be up in a chair, or that kind of orders, that those are carried out and implemented. If the patient's to have vital signs every 4 hours, she's to be sure that the patient is getting their vital signs every 4 hours, or that the patient is on strict INO as what the doctor orders. She may not be the one that's jotting that number down every time the patient's tray is taken, but she needs to be sure that that's being done. So that's what team nursing is about, okay? And then the last one is primary care, and that's one nurse. The primary nurse has 24/7 authority, and this is the kind of care that I personally used to do when I worked in critical care. I was responsible for all the needs and all the care of the patient that I was assigned to. So I did their bath, I did their vital signs, I did their AccuCheck, or I did their blood sugars, and just gave all the care. And I didn't delegate that to anybody on my team because I was the primary nurse. Okay, so that's the different types of nursing care delivery systems that we see in some of the healthcare facilities of today. And then again, understanding different types of healthcare settings, specific agency policies, procedures, and understanding clients' barriers to accessing healthcare. And your book did talk about some of those barriers, We know there are some patients out there who are uninsured as well as underinsured. And again, lack of health insurance is a big barrier to accessing health care. It says in your book in 2013 the rate of uninsured non-elderly had dropped to 16.7%, and it continued to drop over the next 3 years. As of January 2017, some 28 million people were enrolled through the ACA marketplace or Medicaid expansion. And many of these newly insured had gone without insurance for long periods of time in the past. And again, some of these people who did not have any health care insurance, especially your low-income individuals and people of color, and Hispanics and black populations had the largest declines in uninsured rates. But despite these improvements, we are still seeing people who do not have health insurance. And the primary reason that people are uninsured is that they cannot afford to be insured. Some 3 million people are poor uninsured adults, earn too much money to qualify for Medicaid, and people who are uninsured may delay treatment or opt not to receive it because they must choose to pay either for medical care or for basic necessities such as food and housing. And obviously that's a necessity for survival, and so they go without that type of health care. And most uninsured individuals do not receive health care services for free or at a reduced rate and are often billed at a higher rate. So, and then children with health insurance are more likely to stay healthy and do much better in school, setting them on a course for better health and better opportunities throughout their childhood and through their teenage years. So that's a very important thing to remember. And remember, the Affordable Care Act affected children favorably because it prevented insurance companies from denying coverage for pre-existing conditions and from dropping insured individuals or their dependents because of their onset of serious illness. So that's something to think about as well. All right. And again, another barrier could be the lack of usual source of care, where the individual regularly receives care, experiences improved health outcomes, will develop fewer health disparities and lower cost. And a usual source of care is sometimes referred to as a medical home or a health care home. So some people are lacking that as well. Okay, so this kind of sums up from the PowerPoint a little bit about healthcare delivery. So be sure that you review this PowerPoint and refer back to these important points that were discussed on these slides and that I discussed with you as well. All right, class, what I have up here now is an activity that we would normally have done in class, and this is in your weekly lesson plan. It will give you the weekly assigned reading information as well as all the activities that we will do together. And we're going to try to do them as best as we can through the online delivery. Okay, so right here with Appendix 1, we're looking at healthcare settings. And as you can see, we have various groups. In Group A, we have Mercy Regional Medical Center, which is a hospital. And then we have the Elyria Health Department, which is public health. And then we have Center for Orthopedics, which is a huge building over there in kind of the Sheffield Village area, which provides a lot of physician offices. And then Hospice of the Western Reserve is hospice. And then, of course, Mercy Health, Sports Medicine and Rehabilitation are physician offices, ambulatory care centers. Okay, and then we can go to Group B. All right, let me bring that up a little bit in the screen for you. And as you can see, we have Cleveland Clinic, which has just about everything: hospitals, ambulatory care centers, Lorain City Health Department, public health, North Ohio Heart Center has physicians' offices over by the Gates Building by Elyria Hospital, or now which is UH. Mercy New Life is hospices, and Grace Hospital is a rehabilitation center that also has subacute facilities and some extended or long-term care facilities as well. And then up here in Group C, we have, again, more examples. Lewis Stokes Cleveland VA Medical Center is obviously a hospital. Lorain County Health Department is public health. Superior Medical Care are ambulatory care centers. Mercy Occupational Health is occupational health clinics, and St. Mary of the Woods is retirement and assisted living facilities. And then in Group D, we have many more of the same, okay. University Hospital, which is the old Elyria Memorial, or now it's Elyria Medical Center, is a hospital. Lorain County Health and Dentistry is a public health. Psych and Psych Services are physicians' offices along with crisis centers. And then Abbeywood Retirement Center is retirement and assisted living facilities. And Apria Healthcare are home healthcare agencies. Okay, so these are a lot of the hospitals and healthcare systems that are out more east, going into Cleveland, out in the Elyria area, Lorain area, okay, kind of more east of like the Sandusky and areas like that, okay. And again, just wanted to kind of show you all the various types of healthcare agencies out there. Firelands is obviously a hospital. Lorain County Free Clinics are public health and some ambulatory care centers. Stein hospices. North Center crisis centers as well. Ambulatory care centers, support groups. Avon Oaks is extended long-term care centers, retirement and assisted living facilities, and rehab centers. Fisher Titus are hospitals. Planned Parenthood is ambulatory care center and again crisis centers. Ames Family Hospice hospices, and Lucy Idle Center is extended long-term care facilities, some daycare centers, and TLC Home Health of Ohio are home health care agencies. And those were in Group E and F, and then in G are Bellevue Hospital. DaVita Dialysis Centers is ambulatory care centers. EMH MedWorks is occupational health clinics. Westland Village are subacute facilities, extended long-term care facilities, retirement and assisted living facilities, and even some rehab centers. And Specialty Hospital is extended long-term care facilities and rehab centers. And then your Lorain Family Health and Surgery Center are ambulatory care centers in Group H. Alzheimer's is support groups. Amherst Hospital are hospitals. Visiting Angels are home health care agencies. And Elmcroft Senior Living is retirement and assisted living facilities. So these are so many examples of the types of facilities in which we as nurses can provide health care to the people of our community. All right. All right, what I have here for you now is let's do this activity together. This would be in your Appendix 2. And we're just going to look at the various types of team members and kind of determine what would be their job or what would be their role in providing care to our patients. Okay, the first one is a patient who has been previously healthy, now complains of weight loss and has a low albumin level. And I want you to think back in Nursing 100 when I talked about albumin and the importance of that particular protein and what it does for the body. But which one of those healthcare team members, which is one of our exemplars, would be responsible for that particular issue or that particular problem with the patient? And remember, some of these can be used more than one time. and some patients can have more than one team member. So let's think about that. Somebody that's losing weight, maybe we would bring in a registered dietitian, and of course the medical care provider or the healthcare provider would also be managing this patient's particular problems, okay? Number 2, a patient who will be going for elective heart valve replacement surgery in the morning requests that he receive communion this evening. So think about what that would, who that would involve. Oh, very good. Spiritual support staff. Don't forget, we get so wrapped up in providing physical care to our patients and good physical care. But we also have to think about the spiritual health of our patients who do have very strong religious convictions and beliefs, so we want to make sure that we address that as well. That's why I find it important to look in their database and see what their religious beliefs are, what their faith is, and be sure that those particular ministers, priests, rabbis, whatever, are coming in to see the patient if that's what the patient requests as well. Okay, number 3, a healthcare provider has requested that his or her patient who has an irregular heart rate when examined in the office have lab studies such as a potassium drawn right away. What would that one be? Let's think about that. Oh, that would be a laboratory technician. Very good. I knew that's what you guys were all thinking. Number 4, a patient has had a recent stroke and has difficulty holding utensils for eating. Think about that. Which one of these healthcare team members would be very beneficial to this patient? You're absolutely right. It is an occupational therapist. Very good. Very good choice. All right. Number 5, a patient leaves his healthcare provider's office with 3 new prescriptions to add to the 4 medications he is already taking. He is worried about medication interactions. Absolutely. So who would be beneficial to consult with this patient about his medications? Oh my goodness. It would be the pharmacist for sure. They are the experts with medications, but also he might get that information from his medical provider as well, because he's the one who's ordered them. Very good. Number 6, after a total hip replacement surgery, a patient requires assistance to ambulate and regain his strength. Who might that be? You're absolutely right. It is a physical therapist. Very good. A patient has a temperature of 39 degrees, which is Celsius, which is really 102.2 degrees Fahrenheit, and complains of feeling achy and cold. Who would that be? Think about it, think about it, think about it. They would probably call their doctor. Okay, the medical provider. Very good. All right, so let's go up to question 8. Okay, let me put it in the screen for you. All right, you guys are doing very good with this exercise. A patient falls at his home and now complains of pain in his hip. So he's probably got to have an x-ray, so who would be involved in that care? I'll be darned. It would be the radiologic technologist. Absolutely, or the medical provider who would order the x-ray as well. Number 9, a patient has a chronic respiratory disease and has now been ordered to have nebulizer treatments with a bronchodilator. Oh my goodness, who would this be? Yes, the respiratory therapist. Very good. He would be in charge of maybe providing home health care, to the patient after he leaves the hospital, as well as delivering these treatments while the patient is an in-house patient as well. Number 10, a patient with terminal cancer wishes to go home but is no longer able to perform her many activities of daily living. Her spouse needs information about caring for her at a home, including equipment needed. That would be the social worker. Very good. And number 11, a patient is having difficulty swallowing after receiving trauma to the head and neck, and that would be the speech language pathologist. You guys did very good with that. Now these are very good examples of what you might see on your test. So you might want to go over these again, and if you're able to decipher what each one of those particular team members does with their particular area of expertise, all these, then you will do very good with those questions on the test. Good job, everybody. Good job. All right, class, what we're going to do now is let's do some practice questions from all the information that we talked about involving healthcare team members, okay? So let's look at question 1, okay? The nurse is caring for an older adult who lives alone and is to be discharged in 3 days. He states that it is difficult to prepare adequate nutritious meals at home for just one person. To which of the following members of the healthcare team should the nurse refer him? The registered dietitian, the occupational therapist, the physical therapist, or the social worker? Think about it. Think about it. The answer is social worker, D. A social worker can make arrangements for a meal delivery service to provide nutritious meals daily or recommend a congregate meal site near the patient's home. All right? Hopefully all of you got that. Okay, question 2. A goal for a patient who has difficulty with self-feeding due to rheumatoid arthritis is to use adaptive devices. The nurse caring for this patient should initiate a referral with which of the following members of the healthcare team? Now this is a select all that apply, so let's see if we have more than one answer here. Think about it. Think about it. The answer is D. An occupational therapist can assist patients who have physical challenges to use adaptive devices and strategies to help with self-care activities. So it was only one answer. Good job. Good job, everybody. Question 3. Now this is a select all that apply. A post-operative patient following knee surgery is concerned about the effects of the pain medication he is receiving. Which of the following members of the healthcare team may assist the patient in understanding the effects of the pain medication? Oh, who would be responsible or able to discuss this with the patient? All right, let's think about it. The answer is A, the medical provider. The pharmacist and the RN must be knowledgeable about the medications that they prescribe, dispense, or administer. It is not within the scope of practice for a certified nursing assistant or a respiratory therapist to teach patients about medications. Hopefully you all understand that, okay? And question 4. A patient who has had a stroke has persistent problems with dysphagia. Does everybody know what dysphagia is? Because you need to know what that term refers to before you can answer the question. The nurse caring for the patient should initiate a referral to which members of the healthcare team? All right, think about it. Think about it. And the answer is D. The speech-language pathologist can initiate specific therapies for patients who have difficulty with eating due to swallowing difficulties. And dysphagia is when someone has a difficulty in swallowing. And our concern with that is, because we have to think about why that is, because if a patient has difficulty swallowing, they're at such a high risk for aspiration of either a liquid or the food that they're eating. So this is why it's a very concerning situation for us as nurses, and why we need to bring in the speech-language pathologist in, okay? All right, number 5, another select all that apply. A nursing instructor gives some nursing students examples of tasks that UAPs may perform. Which of the following should be included? Can they bathe, ambulate, toilet, determine pain level, and measure vital signs? Think about this answer, okay? And the answer is A, B, C, and E. Now, they may ask the patient, especially if the patient says to them, I'm having a lot of pain. The nurse may say, okay, can you tell me your pain level from 0 to 10, with 0 being no pain and 10 being the worst pain you've ever experienced. They may say an 8, and the UAP may come out and tell the nurse, you know, the patient told me he had a 8 out of 10 pain. The nurse will definitely go back in and assess the patient again, but that might be what D means. I think the word should be better analyzing pain level, That might be a better word to use rather than determining, and then we know for sure that a UAP cannot analyze any type of data that the patient provides for the nurse. Okay, so there you go. There's some 5 practice questions, and you may see some of these very similar types of questions on your first exam. All right, well, you did very good with these exercises, and these are all uploaded in your Canvas course in week 1 under modules. And now we're going to continue talking about the National Patient Safety Goals. All right, and we'll move on to that in just a minute.